Hello and welcome to this UniTaster On Demand video. My name is John Cheek. I'm here from UniTasterDays and I'm going to be hosting this event today. And today we're going to be looking at university courses in operating department practice. I'm absolutely delighted to be joined by Lorraine Horton Smith, who's joined us from the University of Huddersfield, to tell us about courses in operating department practice, also often known as ODP. In terms of what Lorraine will cover, and you'll find out in a second because Lorraine will speak very shortly, she's going to look at things like what to expect if you study an ODP course, but also some reasons to consider it and some other bonus bits as well. Over to you, Lorraine.
So I'm your speaker today. I'm Lorraine Horton Smith, and I'm a very proud registered operating department practitioner, or ODP. I'm also a senior lecturer in ODP at the University of Huddersfield, and I'm the admissions tutor and I'm the year one lead as well. So I'm a great person to give any help and advice or to ask any questions of about what we expect to see on personal statements or what the criteria are for admissions. So you may be sitting there thinking, I've never heard of an ODP, and you are very much not alone in that. So ODPs work mainly in theatre environments. We'll have a chat about where else we can branch out as well. But I think because we work sort of behind those closed doors, and some people don't really want to know what happens behind those closed doors, we tend to be really quite a hidden profession. And of course, yes, we do introduce ourselves to our patients when they arrive in the anaesthetic room. We tell them who we are and what we do. But because of the things we do to our patients, i.e. we're giving them a general anaesthetic and lots of medication in a lot of cases, they don't tend to remember what we've said. So that's maybe one of the other reasons why we're not particularly well known. So quite a lot of people think, and I certainly thought this before I discovered this profession, that to work in operating theatres, you need to be a nurse, and absolutely you don't need to be a nurse at all. If you're an ODP, that means that you are ready and you are qualified to work in an operating theatre right from the point when you qualify and you register with the Healthcare Professions Council. So let's have a look at what ODPs do. So mainly we're working in three areas. And the first of these is anaesthetics. So we're not a doctor, we're not an anaesthetist, we're not a surgeon, and we're not a nurse, but we do work as anaesthetic practitioners. So what that means is we are supporting the patient and we are supporting the anaesthetist during the time where they're having an anaesthetic. So we are getting the anaesthetic environment ready. We are checking and making sure that everything's okay with the equipment. So that's things like the anaesthetic machine, it's things like the ventilators. And you'll have heard about patients needing ventilators probably in the patients that are in intensive care units at the moment with COVID. And you'll have heard that lots of people are on ventilators. And we're very much expert at looking after critically ill patients who need ventilating. So we're finding that our transferable skills are being particularly recognised at the moment. And a lot of my ODP colleagues are working in intensive care units at the moment, supporting these ventilated patients. We're probably the first person that the patient is going to meet when they actually get to the operating department. So we welcome them, we get to know them a little bit. We gain their trust because, of course, they're very nervous, they're very anxious, and they're putting their lives in our hands in effect. So it's really important that we have good communication skills and that we can demonstrate that we're listening to our patients and that we can show that we're trustworthy and, you know, that we will do the right thing for them while they're at their most vulnerable, really. So we'll check to make sure we've got the correct patient, you know, we're the last port of call to make sure we've got the right patient for the right procedure. We're checking allergies, when they last ate and drank, things like that, all to make sure that that patient is as safe as they possibly can be while they're having their surgery. We will support the patient as they're having their anaesthetic. We will support the anaesthetist in giving the patient their anaesthetic, but it is the anaesthetist who actually provides the anaesthetic to the patient. We need to be experts in airway management because we do take away our patient's ability to breathe quite often when we give them a general anaesthetic. So we have to support their airway by using various devices, which we then connect up to the ventilator. We also then work in the surgery or the scrub role, and that's the one that you might well have seen on Holby City or something like that, Grey's Anatomy, where you've got somebody who's working alongside the surgeon and they're passing the instruments to the surgeon, okay? So that person could very well be an ODP. We're responsible for preparing all of the equipment, all of the instrumentation that would be needed during an operation. And we'll also have things on the side just in case we need them, in case anything changes or anything goes wrong. So we're responsible for making sure we know what we've started off with and that we get all of that stuff back at the end, because of course we don't want to leave anything behind in our patient. It's never happened on my watch. It's never happened to anybody that I know that's an ODP, but every now and again you read something in the newspaper about a patient's found a pair of scissors that's been inside their abdomen for the last 3 years. No idea how that happens with all the checks that happen, but every now and again it crops up, but certainly not in my experience. This role involves a lot of anticipation. So as you get to be a good ODP, when you've got lots of experience, you'll be doing a procedure with a particular surgeon and you know what they need, you know what's coming next. And you're also keeping an eye out for anything that might be happening that might be looking like it's going a bit untoward, and you'll be ready to provide emergency assistance if that's necessary. And then we move on to post-anaesthetic care, or the recovery role. So this is where we're looking after patients as they're emerging from their anaesthetic. So it may well be that when we have that patient handed over to us, they're still asleep. They've still got their breathing tube in. So it'll be up to us to use our clinical judgment as to when that breathing tube can be safely removed from the patient when they're waking up. We're monitoring the patient to make sure that their vital signs are okay. So we're keeping an eye on their blood pressure, their heart rate, their oxygenation levels, things like that. We're also checking any wounds to make sure that they're not bleeding, and also keeping an eye out for any other kind of complications that could be happening. When our patients are able to speak to us, we're checking to see if they're in pain, whether they're feeling unwell at all, and answering any questions that they might have. So it's very much a role where you're one-on-one with your patient and you're taking care of them until they're fit to go back to the ward. We also work in out-of-theatre environments. So I've already touched on the work that we can do in intensive care units. One of my favourite places to work is the maternity unit. Of course, we have ladies who need caesarean sections and other kind of obstetric interventions sometimes. And so we need to work with the surgeons and the anaesthetists and the patients in that environment as well. And that's one of my favourite areas. So I might be the scrub practitioner working opposite the surgeon who's doing the caesarean section. So I'm right there at the cutting edge, really, of that surgery happening. So we really are very much in there and right up close and personal with the patient. Other areas where we work are resuscitation units in the accident and emergency department. So we might carry a trauma bleep, and when that goes off, we have to run down to resus to see what's happening, and it could be anything. You never know what you're going to get when you go down to resus. So it can be quite exciting, it can be quite challenging. You might have somebody who's had a serious car accident, you might have somebody who's had a head injury of some sort or a stroke. So you'll be working with your anaesthetist to stabilise that critically unwell patient, all the way through any interventions that they might need, right through to where they end up after we've decided where they need to go and what they need to have done. Sometimes that will mean accompanying that patient up to your theatre department and staying with them all the way through their operation. Other times it might be that our hospital doesn't do that particular type of surgery. So in that case, we may have to go in the back of an ambulance with our anaesthetist, with the patient, to take them to another hospital and deliver them to the surgical team over there. So it can be very varied and very, very exciting. You might also find that you're part of the resuscitation team. So you might have what we call the crash bleep. And so if somebody has a cardiac arrest somewhere in the hospital, or has happened to me once in the hospital car park, then you're running to where you need to be and you're part of the team that is going to be resuscitating that patient. So doing CPR, setting up drips, getting equipment ready, that kind of thing. So it can be very diverse, very interesting and very challenging. Quite often get asked about career progression, and there are lots of things that you can do as an ODP. Some people very much like staying in the theatre environment, and that's fantastic because we need good, experienced ODPs working in our operating theatres. So we do have some who just remain in that environment for the whole of their career, and they just develop their skills and maybe work up to being senior operating department practitioners. There's also leadership and management roles that you can do. So things like being a theatre team leader or a theatre department manager. with a couple of ODPs that I know who are recent graduates, well, or not, maybe not so recent graduates, who are working as matrons. So they're really quite high up in the management structure. We've also got advanced roles as well. So some people will go on and do master's study in things like anaesthesia associate or surgical care practitioner. And that just allows you to get more hands-on with surgery and anaesthetics. I've also got a recent graduate who has become a research ODP. So there's lots of things that you can do in the research area if that's something that interests you. Can do what I've done and move into education. That's always rewarding, is educating the next generation. But if you're not thinking about being an academic educator, you might want to be a clinical educator. So you might be a mentor to new students, because that's a very valuable role, is looking after our students and doing that well while they're on placement. I've already chatted about leadership and management and some of the roles that are available there. And then we'll just have a chat about entry criteria. So I can only speak for my university, but I think it's fairly universal that we're looking for 112 UCAS tariff points. And that's because, yes, there's a lot of practical work in this, but there's also academic study as well. So we need to know that you've got that academic ability to be able to deal with that, to be able to deal with putting in work that's at degree level. So we don't really mind how you get to your 112 UCAS tariff points, certainly from my organisation. So it might be something like 2 Business C at A level, distinction merit at BTEC. Access courses we also take, so that's 45 level 3 credits. 15 of those need to be at distinction and 30 at merit. Cash level 3 extended diplomas at a grade B. Certainly for us, there's no way getting around having your maths and English at level 2. So that's either GCSE grade 4 and above or functional skills level 2. There's literally no way around that. Some universities will want you to also have a science subject in your GCSE profile. We don't insist on that at Huddersfield, but that's very much an individual institution's point of view. Thinking about your personal statement, we understand it is very difficult to gain any kind of experience or observation in an operating theatre, and there's lots of reasons for that. We need to think about safeguarding, we need to think about privacy and dignity of patients. You know, we can't just let loads of people in to observe operations. So we completely understand that it is so hard to actually get any kind of experience in an operating theatre. So we don't insist on that. Obviously, if you've got any kind of science background or any kind of health and social care background, that will help you when you're actually on the course. But certainly we don't ask for that in particular, because we think we can teach you all that. We assume everybody who arrives at our institution doesn't really know anything about ODP or about healthcare or about anatomy and physiology, and we start to teach you all that from scratch. What you can expect when you're on the course is there'll be a split between theory and academic work and also practical work, actually working in operating theatres. So really quite soon into your study, we'll get you out to placement. So we'll teach you the basic theory that you need, and then you need to go and actually have a go in practice. So we do let you work on real life patients, but of course you're under very close supervision. We don't let anybody do anything that we feel or that they feel they're not comfortable with or that they're not competent to do. But we do get you out into clinical practice as soon as we think it's safe to do so, because you really need to see what it's like and to actually practice what you've been taught. So yeah, you probably spend more time in placement than you do at the university. During COVID, we've done quite a lot more things over video than we've ever done before, and but it hasn't completely replaced what we are actually doing on campus. But we're exploring how students want us to deliver that content. Now people are starting to get used to it. So we will be canvassing opinions as to how we deliver our sort of academic work, really. You know, what sort of mix students want between face-to-face teaching and more online, maybe self-directed training. So that's something that we're investigating at the moment. So One of the things I get asked quite often is, why do I think that this is a great career? And I do genuinely believe that it's the best job in the world. I came to it relatively late. I was quite a mature student when I started, and I came from a completely non-health related background. I used to work in a call centre for an insurance company. So that is literally no barrier to you joining this course, okay? And the reason I think it's the best job in the world is the variety. It's the job satisfaction, and it's knowing that you've made a difference to somebody. So in terms of the variety of the role, you can really think about where you might want to work and what kind of surgeries you're wanting to be involved with. You might decide that you only want to do anaesthetics. You might decide that you want to do anaesthetics and scrub, or you might decide that you want to do all three. So you'd look for a hospital that would offer you really what you're looking for when you're looking for a job at the end. There's all sorts of different specialities. So I've already mentioned maternity and obstetrics, but there's all kinds of things. There's like trauma, there's neurosurgery, there's transplant surgery, there's orthopedics, there's general surgery, there's ear, nose and throat, loads and loads and loads of different specialities, and so many things that you can get to be involved with. And it really is exciting. It changes all the time as well. You know, we get new surgeons in who've got new ideas and new techniques. We've got new anaesthetists who come in and they've got, you know, new ideas of doing things. New kit is invented all the time. New ways of doing operations are invented all the time. And one of the really exciting things that's coming along at the moment is robotic surgery. So we have surgeons sitting in the corner of the operating theatre with this robot that looks a bit like a giant spider that's over, you know, sort of standing over the patient, and the surgeon is using joysticks to manipulate the robot to actually do the operation, which they're instructing from a distance. So it's absolutely fascinating, the things that can be done. So it's never a dull day, you're always learning. The other great thing in terms of variety, and I use this as an example quite a lot, is, you know, say I was working a long day, so I was doing a 3-list day, which would probably take place over 13 hours. And so in the morning, I might be the scrub ODP working in obstetrics, so I'm scrubbed helping deliver babies. In the afternoon, I might be working in recovery, recovering children who've had the tonsils out. And that's always sad because they're always really upset, bless them. And then in the evening, I might be working in anaesthetics, and I might be doing anaesthetics for what we call acutes. So that's really emergency things like appendectomies, strangulated hernias and things like that. So you can see I can have a great variety of things that I'm involved with and that I'm doing. So it just really doesn't get boring. Another great thing, as I mentioned, is this job satisfaction. This knowing that I've been part of a team that has, you know, worked with this patient, potentially saved somebody's life, potentially improved their life so much for the better. I might have met them in resus when they came in from the back of an ambulance being really gravely injured. Then I followed them all the way through theatre and been part of that team that's potentially delivered them back to their family and friends at the end of it. So the job satisfaction is outstanding. It's amazing. Another great thing is I can only be asked to look after one patient at a time. So I can focus all my energy on that one patient. And if I'm doing my job right, I know I've done a good job. If I'm a nurse working on a ward, would I be able to do that? Probably not. And certainly from my perspective, that ability to do absolutely everything 100% correct, because I've got time to do it, because that's the only patient that I'm looking after, it's just brilliant. So I know that I've always done a good job and that I've always done everything to the best of my ability for that patient. Something else that's really good about ODP is there's a national shortage of ODPs at the moment. And so job prospects are really good. So for instance, my third years, those of them that have wanted to were starting to get their job offers through at Christmas. So they were being interviewed for jobs at Christmas when they don't qualify until the summer. So they already know that they've got their job ready and waiting for them. Some of them have got 3 or 4 job offers because they haven't quite decided where they want to work. So job prospects and employability is amazing. In all the years that I've been associated with ODP at Huddersfield, which is 12 years now since I started my training, I've never yet known anybody who's qualified and not been able to get themselves a job as an ODP at the end of it. I've just never known it. Obviously, I can't say what's going to be happening years from now when you guys, if your interest in this would end up qualifying. I can't say what the job market's going to be like then, but I can't see that demand is going to change. People are always going to need operations. And so I really do believe that demand for ODPs will always be there. So really, that is everything that I was wanting to share with you about the wonderful world of operating department practice. I have just popped my email address up there, but I do understand there are other institutions around the country that do offer ODP. But yeah, that's my address for us here at Huddersfield. So thanks very much for listening, and do drop me an email if you've got any questions.